This is Maggie. Maggie is like any young teenager, full of life and energy.
Every week I do 2 loads of basketball, 3 loads of water polo, 1 load of swimming and 3 loads of dancing.
It's hard to believe this beautiful young child lives with an illness that has no cure. Maggie has cystic fibrosis, a life-shortening disease. Many people have not heard of cystic fibrosis, but ask a child with CF and they know all too well.
It's a disease where you have too much mucus. It fills up the lungs and all your body and you can't get it out and constantly get it. And get a lot of infections.
Cystic fibrosis is the most common life-shortening genetic disease in Australia, and there is no cure.
It gets pretty hard to breathe at times. Usually my health is alright, I'm not bad. It's about 40% lung function. A normal person is about 100. So yeah, it's not good.
A CF patient undergoes a grueling daily regime of up to 3 hours of treatment, including chest physiotherapy to clear the mucus from the lungs. They frequently suffer respiratory infections which gradually damage the lungs. CF is strictly genetic and is not contagious.
Put in surgery pretty much straight away, so by 30 hours old she'd come through her first bowel operation. We then met with the doctors who told us our little girl had cystic fibrosis. We had no idea what that was or what it entailed at the time.
Cystic fibrosis is the most common fatal inherited disease affecting young Australians. About 1 in 25 Australians carry a defective version of the gene that causes CF, usually without knowing it. CF causes pancreatic insufficiency, so patients must take enzyme supplements with each meal to enable them to digest food properly. Every 4 days in Australia, a child is born with cystic fibrosis.
It was scary because I was unaware of what the illness actually was. It was overwhelming. I was thinking of her future or lack of. Because I had lack of education of the illness, I was obviously fearful. But I can appreciate that it's treatable and that it's a manageable illness and that I still get to have somebody to cherish and make me want to be a better person.
If 2 people are genetic carriers for CF and they have a child, there is, with every pregnancy, a 1 out of 4 chance that the child will have CF and a 2 out of 4 chance that the child will be a genetic carrier for CF.
We're hoping that the treatments that the kids receive at the Cystic Fibrosis Clinic will let them live a longer life. I think that's the important part, is longevity, and to hope that they see adulthood and perhaps not necessarily have a family of their own, but respect life.
Through early diagnosis and aggressive management, many children with CF are now surviving into adulthood.
Maggie's routine's fairly full on because she has to stay fit and she has to have 150% calorie intake compared to normal children. So she's had physiotherapy twice a day, every day, including Christmases and birthdays, since she was a month old.
The Cystic Fibrosis Clinic for Kids at the Children's Hospital at Westmead is one of the largest paediatric clinics for CF in the Southern Hemisphere. It provides local, interstate and overseas patients with multi-disciplinary team care for CF. The majority of the children in New South Wales with CF are regularly treated at the clinic.
So we live 10 minutes away from the hospital. We've sort of decided we can't move away from the hospital right now because Matt's so sick. And we're here at least once a month. Sometimes every 2 or 3 weeks we're popping into the hospital. So yeah, the clinic is just wonderful.
Dr. Peter Cooper is a respiratory physician and the director of the Cystic Fibrosis Clinic at the Children's Hospital at Westmead. He credits the improvement in survival of the child with cystic fibrosis in part to the fact that all babies in Australia are screened for CF at birth which allows diagnosis and lifelong treatment to commence at an early stage.
When I started in cystic fibrosis about 25 years ago, most children didn't live until they were 21. As time passes, the child with cystic fibrosis inevitably undergoes a deterioration, particularly in their lungs. With expert care, we fully expect most of our children now to live till their late 30s or early 40s. But the truth is that most of these children will die before their parents.
But there is some good news. Life continues to improve for all patients with CF because of ongoing medical advances.
At this hospital, we have one of the largest cystic fibrosis clinics anywhere in the world. We have a whole bunch of motivated children and families, and as a result of it, and thanks to their interest and passion, we're able to participate in research in cystic fibrosis, research that has brought groundbreaking results in how we look after children in cystic fibrosis.
Everything you do, you get back 100-fold. And I think that's, our daughter's health is evidence of that. The clinic supports dietitians, which are terribly important, physiotherapists, psychologists, and funding for those positions, which are terribly important, needs to come from outside the hospital system.
Treatment for cystic fibrosis is complicated and needs expert teams to provide that care. Unfortunately, hospitals are unable to provide all the resources that are required to maintain the health of these young people. We need help for staff, facilities, equipment, medications, and research.
Please support the Cystic Fibrosis Clinic for kids in their fight for life. Help give the breath of life to young Australians with cystic fibrosis.
Your help makes a difference.
Your help really makes a difference.